I mean, I'm so inspired by Jennie's model and the JJ way, and you've talked a lot about replicating effective models from one system to other geographies, whether it's other places in the US or internationally. What would your advice to Jennie be, or what would your recommendations be on how could we scale up the JJ way and see it really take place across this country and around the world?
Well, I think the first thing is to do what you've done is make sure we know your story. And the second thing is to make you make sure your story gets known. Write a book.
Exactly.
Do a film.
Right. We do a lot of outreach,
all of that.
a lot of awareness raising.
And then, and in terms of other countries, do the same. Make sure, maybe we'll send somebody down to study what you do, and help other countries learn from what you've done.
Yeah, Jennie, what could you use from this community in terms of scaling up that model?
All of the above.
Yeah.
I think at this point, what we're looking at is recognizing what are the components that make it different and make it work. And one of the most important ones is that there is no barrier to care. And that's inside of a system where there are many barriers to care. So we've taken that piece right out of the way immediately. And that engenders so much trust and relief. Our front desk is usually where everybody's just dissolving into tears on the hour every hour, because the women are so thankful that someone will let them in. The staff are so empowered to be able to support the people who present for care. We don't turn anybody away, regardless of whether they've got money, insurance, the right card, documentation. That in and of itself seems to make the difference physiologically. How would something as simple as that create a cervix that will hold tight and keep a baby in for 40 whole weeks? These things are what I'd like to get out. Like, are these simple, cost-effective, and in some cases free, literally free interventions that could be done? Could we just go ahead and replicate that? So we don't have universal health care, we get it. But at the same time, how can we not implement access points for people who we know need the access, and in the lack of that access are going to end up costing all of us, including themselves and their families, ridiculous amounts of money for the lack of that?